This PetX Talk is brought to you by Natura Pets, Found Animals, and Dogwise Publishing.
Hi, I'm Dr. Rob Silver. I'm an integrative veterinarian in Boulder, Colorado. And as a veterinarian practicing in Colorado, I've developed a bit of an expertise regarding the medical uses of cannabis, and that's what I want to share with you today. The title for my talk is Medical Cannabis, What Every Pet Parent Needs to Know. And before we can really get into the details about medical cannabis, I think it's important for us to define some terms that you may not be familiar with. One term is cannabis itself. What is cannabis? Cannabis is a plant. It describes, cannabis describes the botanical name, the species of this plant. It's been around for many, many years. It's believed that in human prehistory, 10, 20,000 years ago, it may have arisen in the Kush Mountains of Afghanistan. But from there, over the last 10 to 20,000 years, it is everywhere. It is global. What is marijuana? Marijuana is a type of cannabis. Marijuana and cannabis are the same thing. Marijuana is the cannabis plant that contains higher levels of THC, greater as defined by law than 0.3% as measured on the plant at harvest. The other type of cannabis that I want to define is called hemp. And hemp is also cannabis. It comes from the cannabis plant, but it has been bred so that it has a low level of THC. In every other respect, hemp can be equivalent to marijuana minus the THC, minus the get high component. So THC is a cannabinoid. CBD, cannabinoid. You've probably heard these terms before. What do they stand for? They're abbreviations for long chemical names, like THC stands for tetrahydrocannabinol. CBD stands for cannabidiol. Cannabinoids are a specific class of molecule. They're fatty, and they can enter your brain very easily, and they have a multitude of effects within the body that I will describe in just a little bit. But in addition to the cannabis plant containing these cannabinoids, and THC and CBD are just two out of maybe 70 or 80 total numbers, and there's dispute and debate. I've heard people say as many as 100 cannabinoids or as few as 60, but nonetheless the important ones are the THC and the CBD. But there's other cannabinoids which also have medical benefits every bit as potent as CBD and THC, but the only component in the plant that gets you high is THC. Some people want to get high. They want to have the THC in the plant, and they might use it in a recreational context. But in addition to that aspect of THC, it also has very beneficial medical aspects. CBD, another cannabinoid, has many of the same, almost identical medical benefits that THC does, but it doesn't get you high. So for people who want to get well, but they don't want to get high, they look for cannabis plants that have more CBD in them and less THC. So in the hemp plant, it has such a low amount of THC that it doesn't get you high. Some people think that's stupid because they just want to get high. But for people who want to get well, they're looking to hemp to solve many of their problems because it doesn't have the THC component. There's a few things, few medical things that we would want to use THC for, but they're not as common, and I'll discuss them in the second talk I'm going to give, which is going to give you practical applications, how to use cannabis for your pet. So in addition to the cannabis plant, it's very rich. It's rich in all of these molecules, many of which have very important biological functions or biomedical activity, as we call it. So we have our cannabinoids, and we know that there's 60 of them, or there's 80 of them, there's a bunch of them. THC and CBD are the main ones. But then we have molecules that are called terpenes. And terpenes are the things that when you squeeze a lemon and you smell that lemon smell, what you're really smelling are terpenes. When you take some lavender and you smell the lavender and it smells so wonderful and kind of calming, That's a terpene. The terpene in the lemon is called limonene. The terpene in lavender is called linalool. If you walk through a forest and you love that smell of the pine, that's pinene. And amazingly, the cannabis plant is able to manufacture these terpenes, and actually a total of over 200 terpenes have been discovered in the cannabis plant. Maybe not all of them at the same time in the same plant, but that's really what gives a plant its medical signature. It's what gives marijuana, it's what gives hemp its odor. You know, if you've ever, we've got so many states now where people are using medical marijuana or recreational marijuana, and so if you've ever seen people in a dispensary, maybe you've had that experience, and they're sniffing that little jar, that has the medical marijuana in it, and they go, ooh, that smells really strong. What they're smelling is not the THC and not the CBD, because those have almost no odor at all, just a very slight resinous smell. What you're smelling are the terpenes, and it's really the terpenes that define whether a strain is sativa or indica, because the terpenes can be uplifting, or the terpenes can be sedating or quieting. The terpenes can contribute to appetite, and the terpenes work synergistically. That means the two work synergistically with the cannabinoids, which means that the terpenes and the cannabinoids, when they work together, they make each of them work better and work stronger. And so there's today in the cannabis culture, we're seeing that products are being developed that they actually put extra terpenes into them in order to create more medical benefits. But that's why people select certain strains, because they have blends of terpenes and cannabinoids that produce specific biomedical actions. In addition to the cannabinoids and the terpenes, this amazing plant contains substances called flavonoids. And flavonoids are nature's antioxidants. Those are found in brightly colored fruits and vegetables, cranberries, blueberries, beets, all the things your mama said you should be eating. She had good reason for that, because flavonoids contain nature's antioxidants, and antioxidants help to keep our body protected from the damage of what they call free radicals, which aren't old 60s hippies, but in fact are these molecules that are running loose that aren't bound to other molecules that cause tissue damage. So as you can see, the cannabis plant is very complicated. It's not just about the THC. It's not just about the get high. It has a huge number of components that work together, work individually, work synergistically to create the medical benefits that everyone has been seeing in this plant. So there's a lot of components in this plant, these cannabinoids, these terpenes, and these flavonoids. But why do they work so well in the animal's body or in the human body? Well, the reason is because our bodies themselves, our pets' bodies, even bodies in animals as primitive as the sea squirt, which is a relative of the jellyfish, have their own production of cannabinoids in the body. Cannabinoids produced in the body are called endocannabinoids, inside the body. Cannabinoids that are produced by the plant are called phytocannabinoids, P-H-Y-T-O, cannabinoids. So what happens is that our bodies are already producing these cannabinoids, which are doing a lot of things as far as helping our nervous system to work better, helping to relieve pain, helping with our immune system, helping with digestive function. So our body is already using its own cannabinoids that it manufactures itself. So when you have a situation where you have pain or some disease and the body's own cannabinoids aren't doing a good enough job to deal with that, we can take in external cannabinoids from the plant, these phytocannabinoids, and in many cases, they can help. They can help quite a bit. What we've discovered is that this system that has these endocannabinoids being produced, that will mate up with certain receptors in the body is very primitive. We've been able to trace it back through the different phyla, through the different species, and we find that it is as primitive as the jellyfish, as the sea squirt. Everyone has it. It's such an important system. The only reason that we didn't discover it was because of this 70-year prohibition that we've had on the use and the research into the plant compounds. And we discovered these inner compounds as a result of the little bit of research that we have been able to do with these plant compounds. And so this is why cannabis has such a global effect on the body, whether you're a human or you're an animal. And the things that it can treat include chronic pain and anxiety. In fact, some people have found it really good for this thunder phobia that dogs get with thunder, or fireworks phobia. It also can help with epilepsy, certain types of epilepsy. And in this next segment that we're going to do, I'll be more specific about how to use cannabinoids to address these conditions. It also has been found to have an anti-cancer effect, although not all types of cancers are affected by it, but it can help things like appetite with cancer. It also can help with diabetes. It also can help with digestive function, because receptors for our body's own cannabinoids that receive these phytocannabinoids are present in all of these different tissues in our body, in our immune system, in our digestive system, in our nervous system. So, it's been fun talking to you today. I hope this has been informative. Stay tuned for my next talk.
We just had an amazing talk about CBD and THC in medical marijuana use for our pets, but I have questions, and I want to know more about this and see if it's something for my pet. Who's the expert out there that I can find in my local area? Should I be going to the medical dispensary? Should I be going to my veterinarian? Or is there someone else I might be looking for to help me see if this is the right path for me?
Well, that's a good question. And I will say that as a veterinarian, I am biased. I do believe that veterinarians are the people to go to when you have any question at all about your pet. Unfortunately, though, because of the gray legal or illegal status of medical marijuana, many veterinarians are nervous about giving advice, or in fact haven't even learned what they need to learn in order to give advice. So I would say speak with your veterinarian first, of course. There really are not very good resources out there for the pet owner. I have trouble recommending the dispensaries because people that work in the dispensaries, they may know a lot about medical marijuana, but they don't know about pets. For instance, they don't know that THC can be very toxic to dogs, that THC in fact has caused the death of several dogs. I'm going to be discussing this in my second segment that you'll be recording. So I've written a book because I recognize that the pet parent needs to know. And the book is called Medical Marijuana and Your Pet. And in it, I help to explain and describe how they can use this safely. I don't go into specifics in the book as far as treating specific conditions, but the book is pretty good. I've also created a blog that is free for anyone to go to, which has a segment on cannabis and also has a segment on addressing diseases like cancer and epilepsy and chronic digestive problems. So what I'm saying is true, and I don't have any other resources. That's why I created them. I don't think there's any other books out there by veterinarians or about pets. The ones I've seen are really not veterinary based, So that's why I've put myself out there to be this expert, because no one else is. But someone has to. And there was another veterinarian, a California veterinarian, Doug Kramer, who really championed the cause. And I salute Doug, who unfortunately has left our life here on this planet. Doug passed away several years ago. But veterinarians really do need to speak up, and they do need to help people understand how they can use cannabis best for their pets.
Thank you so much for giving the time for this first talk. Definitely look forward to that second talk we've got coming from you.
Thank you. Thanks for giving me the opportunity to share this information, because it's very important. I think pet owners want to know, they need to know, and if anything, I offer myself as a resource to them for this information.
Funding for PetX Talks is provided by Natura Pets. Natura Pets can help you optimize your pet's health with premium organic supplements from the Amazon and Andes Mountains. Visit naturapets.com. Dogwise Publishing. All things dog. For all of your expert dog book needs, visit dogwise.com. Found Animals. Working towards big ideas that advance the safety and happiness of animals in our homes, our shelters, and everywhere in between. Visit foundanimals.org. This has been a Pet World Media Group production.